Women's Health Wednesday now. January is Cervical Cancer Awareness Month, and it is a good time to talk about how vaccines for the human papillomavirus, or HPV, can help prevent that cancer.
Yeah, it was once the leading cause of cancer death for women in the U.S., and now, thanks to cervical cancer screenings and the HPV vaccination, it's the most preventable of all female cancers.
About 79 million people in the U.S. are currently infected with HPV, a compelling reason to protect teens and preteens through vaccination. The CDC recommends the HPV vaccination for girls and boys as young as 9, but Dr. Benjamin Margolis says there can be hesitancy among parents.
And that can be difficult for parents to think about vaccinating their children against something that is sexually transmitted. But, the fact that it's essentially so widespread among anyone who's sexually active, it really makes that primary prevention so important.
Those who are not fully vaccinated and who are infected with HPV are vulnerable to cervical cancer.
Most people will clear the HPV infection, about 80 to 90%. But in those 10% of people that the HPV infection sticks around, those are the people who are at risk to develop abnormalities of the cervix that can then progress to cancer.
But screenings should begin as early as age 21. The HPV test or the pap test can find precancer that is more treatable.
Laser, cryotherapy, or removing the abnormal cells.
If it becomes cervical cancer, treatments include surgery and/or chemotherapy and radiation.
Most early stages of cervical cancer are very treatable with very high survival rates.
Smokers are twice as likely to get cervical cancer. Those with a weakened immune system and those who are sexually active at a young age are also at risk. But there's also a disparity when it comes to who gets diagnosed at an early stage.
People of color actually get diagnosed with cervical cancer at later stages, and even stage for stage suffer an increased mortality. Recently, we're starting to see that the rates of LGBT folks can have increased risk factors for cervical cancer. And it's really important to reach out to those communities and let those folks know that, if you have a cervix, you need pap smear screenings and you need to think about cervical cancer.
And we have come a long way in HPV vaccination rates, but there is still a ways to go. Only about 60% of adolescents in the U.S. have completed the 3-dose vaccine series.
It's up to 99% effective, and while it's mainly recommended for 11 and 12-year-olds, the vaccine is FDA approved for those up to 45 years old.
That's right. Well, for more of our Women's Health Wednesday